Good morning, Brandon Cook here, Healthcare for the Homeless Program Director, and welcome to our mobile unit. So the Healthcare for the Homeless program started in 2005, and the point of the program was to be able to make sure that individuals experiencing homelessness were able to access primary care, oral health care, behavioral health, and prescription medication. And so one of the things that was going to help us do that, since the service area is so large, it's the entire upstate, so that's all 13 counties, is the use of our mobile medical unit, which is 35 feet long, has 2 exam rooms, and we can really do everything that we can do in the fixed office, we can do on the doctor's office on wheels. So we have providers, we have medical support staff, we have frontline staff, we have the ability to do lab work on the mobile unit, your analysis, things of that nature. And really, the strength of the mobile unit is the ability to go to where people experiencing homelessness are at and provide services on location. Primarily in the upstate, we do see a lot of individuals in emergency shelter. We've had a great partnership with a lot of shelters in the upstate that allow us to come on their campus and be able to work our magic on site. We see roughly about 2,500 patients a year, and that's roughly a little over 5,000 encounters. These are primary care visits, also oral health visits. We also have integrated behavioral health. So really, we're trying to make sure that individuals experiencing homelessness have access to as much primary care as humanly possible. All right, welcome guys. We're here in the mobile medical unit for Healthcare for the Homeless, and this is our 35-foot mobile doctor's office on wheels. We have 2 exam rooms. One exam room you'll see here, complete with an exam table, vital signs monitor, a couple of refrigerators for vaccines, things like that, a storage loft, whole bunch of cabinetry, things like that, so our staff can really have the resources and the tools that they need to do their jobs effectively. This is kind of our staging area. So here we'll have where our provider is. You see she's got her scopes there. But over here, this is our mini kind of lab department. And so when we see patients in the exam rooms, we'll draw their lab work in the room, but this is our staging area. So when we get hemoglobin A1Cs, this is our machine for that. We want to do our urine analysis, we can do that. Even if we need to spin down some blood, we can do that as well. And also we have a printer, so we can print requisitions and orders and things like that. So it's really everything we need right here on the mobile unit. This is our staging area, or our setting area for our nursing staff, so they can have a nice, comfortable place to do their work while they're waiting on the provider to finish up her work. And you can see complete with their waterfall. And so really similar to the first room, again, nice pictures, but we have our exam table, we have our vital signs monitor, really everything that our staff need to be able to do very effective patient care right here. And behind this door, not behind it, but underneath the door, we have our wheelchair lift. So we are able to also accommodate folks who are in wheelchairs or on walkers, and it's very cool. The lift stores underneath the mobile unit. There's a fun little remote. You press the button, the lift goes out, goes down, you pick up the patient, comes back up, and they're right in where they need to be. So another thing that the Healthcare for the Homeless program is really proud of is there was a need in the community for individuals experiencing homelessness who were being discharged from the hospital, who were too sick to be discharged to the street or to a normal shelter, but they weren't sick enough to remain in a hospital. What we were able to do in partnership with Miracle Hill and their Greenville Rescue Mission was establish the first of its kind in the state of South Carolina, which is medical respite care for individuals experiencing homelessness. And basically what that does is provide a safe place for individuals experiencing homelessness being discharged from the hospital to go and recover. And they can go to the shelter under our medical oversight with the help of the staff at the rescue mission to get food and clothes and a bed to stay in. We can really get these folks out of health crisis and have them really transition into a better state of being or a better state of health. So why is this important? why do we need health care for the homeless? Okay, so there's a couple of things. But primarily, we know that in our community, people experiencing homelessness, the number continues to grow. And we also know that without programs like health care for the homeless, like medical respite, people experiencing homelessness use the hospital systems at higher rates than individuals who have insurance or have the ability to access primary care. And we also know that utilization of the hospital unnecessarily also drives up the cost for everyone else in the population. So really what we're trying to do with these programs is ensure that our community is one of the healthiest in the nation.